Oh, hi. Welcome in. You must be my sleep clinic patient, right? Perfect. Let me just get you checked in. I'm Dr. Lavender, and how are you doing this evening? Sleepy? Perfect. We love to hear that. All right, so I'm assuming you took care of all your insurance information with the nurse. Perfect. Okay. So before we begin, do you have any just general questions? I know you'll have more questions as I begin to talk about the process, but just right now. Yeah, okay. So the process will look a little like I will ask you some questions, get some data from you, and then I'm going to take your vitals, apply some electrodes to your forehead here, and then we're going to start the sleep exam. And what that means is I'm going to be doing some ASMR triggers, and we're going to be measuring how your brain reacts to them. Perfect. Okay. And then after that, you will be spending the night in this room. That's why it's very dark and cozy, and why I'm speaking in a low voice. We just really want to have you be as relaxed as possible. It's pretty hard to A, fall asleep, and B, experience ASMR when you're feeling tense and very awake. Okay, so let me finish getting some stuff filled in here. Exactly, that's why it's so quiet in here, is so that you can fall asleep. We actually soundproofed all of our rooms. However, they're not completely soundproof, so every once in a while you might hear some very quiet noise in the background, but hopefully that does not ever wake you up. Okay, so any more questions before I start asking you or going through our questionnaire? Perfect, okay. So, first question, can you tell me a little bit about your sleep schedule? Like what time you fall asleep, what time you wake up, if it's kind of the same every day. Okay, so fall asleep. Midnight or 11, okay. And you wake up, okay. Do you wake up at that time because of work? To go to the gym? Okay. And do you take any naps? Okay. For about how long? Perfect. No, we love naps around here. We highly encourage naps. But we like to keep them between 1 and 2, 1 and 3, and keep them like 45 minutes or so. Which you do exactly. So you're falling asleep the same on the weekdays as the weekend. You stay awake a little later on the weekend. No, that's pretty normal. I will say though that the more you can keep every day the same, the easier time you'll have actually falling asleep at that time. So, all right. How often do you find yourself waking up in the night? Do you fall asleep and then all of a sudden it's morning? No. Oh, I know. People who have that happen to them are very lucky. So you wake up like 2 or 3 times. Okay. Oh, you have pets? Okay. Cats or dogs? Okay. I also sleep with my cats, and they do wake me up a couple times a night. Ideally, we would keep them out of the room, but, you know, we love them, so. All right. Do you take any supplements or other sleep aids like melatonin? Okay, let me note that. Do you remember the brand? Okay. And what about dreams? Do you have vivid dreams? Do you have nightmares? Every night? Perfect. All right, now we're moving on to your personal experience with ASMR. Since you elected to participate in this sleep clinic, I'm assuming you do watch ASMR. Okay? And you do experience ASMR. Autonomous sensory meridian response. Okay, you know. Perfect. Let me just add that. And how long have you been watching ASMR? And did you experience unintentional ASMR prior to watching ASMR videos? Yeah, so like, did you experience ASMR with a teacher, a doctor, a hairstylist, your mom? Okay. All right. And since you've been watching for a while now, have you experienced any tingle resistance? That is to say, do you no longer kind of get the same level of intensity from watching ASMR as you used to? Okay. Have you taken any measures to kind of work on that? I mean, most of the time, all it takes is a break from ASMR, taking like a week off of watching it, especially if you watch it every night. I would also say experimenting with new styles of ASMR, new ASMR artists, new pacing. So like, if you like to watch slow, maybe watch medium. If you like to watch fast, try watching slow and really let yourself relax into it and not get bored by it. Things like that, just kind of experimenting with it. Another solution is to really narrow down on your triggers. So that's what part of the main focus of our sleep exam today is. We're going to be going through popular triggers, and with the electrodes you'll have, we'll see which ones elicit the strongest response. So let's just answer this last question. And I saw you selected soft-spoken. Do you also like whispering? Okay, perfect. I have been whispering a little, but some people really don't like it, so I wanted to make sure. There we go. Well, before I begin to take your vitals, do you have any more comments or things you want me to add to your file about your experience with ASMR? Okay. Wonderful. Okay. No, that's useful to know. All right. Well, I think we're ready to take your vitals. I'm going to put my gloves on. You can go ahead and relax again. Lean back into your bed. Yeah, I'm just going to take your oxygen, listen to your lungs, make sure everything is normal before we begin. Okay. There we go. Okay, so you're comfortable? Wonderful. Let me just put these in. I'm going to just listen to your heart for a second. Now you can leave your shirt like that. I'm just going to place it in a few spots. Okay. And then on your stomach. Alright. Again on your chest. And can you take a deep breath? Good. Another deep breath. Okay. And then around on your back. Another deep breath. Good. And then I am going to lift up your shirt just a little to place this on your stomach. One last time. It might be kind of cold. Okay. Everything looks good there. When was the last time you saw your PCP? Oh, recently? Okay, perfect. Let me put this back on. And then, alright, now we're just going to take your pulse and your oxygen using this. Let me turn it on. So go ahead and uncross your legs and just hand me your hand. I'm going to stick it on your finger like that. Alright, just keep breathing as normal. Alright, you are at 98% and a perfectly normal pulse. Let me go ahead and mark that down. And rate of 76 ppm. There. Alright, we don't have to take blood pressure for this particular exam unless you've had issues with blood pressure in the past. And you just want to know. You're okay. Right. Same with height and weight. Perfect. Alright, now I'm just going to take a quick look in your eyes. This is one of the only bright parts of this exam. There will be one more part with some lights, but I will try extra hard not to shine it directly in your eyes. Okay. Alright, can you look over here? Yeah, keep looking here. Alright, can you look over here? Good. Alright, can you look up here? Can you look down here without moving your head? Alright, keep looking here. I'm gonna open your eyes a little. Keep looking here. There we go. Okay, that looks good. Can you just follow my fingers with your eyes without moving your head? Okay. Wonderful. Alright, now just close your eyes. I'm gonna just look at your eyelids. Again, close your eyes. I'm just going to take a quick look in your ears. This is honestly one of the more important parts of an ASMR sleep exam. We want to make sure you don't have any impacted wax or anything that would be obstructing your hearing. Alright, so I'm going to get a little close and then pull your ear. That looks good. No redness or inflammation. I see a nice healthy eardrum. Okay. And then this ear, let me take a look. There's a little more wax on this side, but nothing to be concerned about. We all have wax, so I don't think I need to do a cleaning or anything like that. And again, no redness or inflammation, so A+ on your ears. Alright, if we don't have any more questions, I'm going to go ahead and set up the electrodes. Let's see. You're not wearing any makeup or anything, right? Okay. So, the electrodes are just these little devices that I'm going to tape to your forehead. It won't hurt at all, and you're actually going to fall asleep with these on your head. Yeah, it won't be itchy or anything like that. We've never had any complaints. Okay, so let me just get things ready. And you said no makeup, right? Okay. And it looks like you don't need to push your hair back or anything. I'm just going to cleanse the 4 spots with a wipe to remove any oils or things like that. There. And then we're just going to take the first 2 of these. And a piece of tape, and then just alright, 1 down. So we put 1 there, and we're going to put 1 a little lower. Alright, that's not pulling on any baby hairs or anything, right? Wonderful. Let me just make sure these are nice and attached. Alright, so then we're just going to place another there and another there. They shouldn't make any sounds or anything like that. You will notice though, they do have a long cord, a long cable, but if you want to go to the bathroom in the night or anything like that, you're going to have to take this machine with you. It is on wheels. You'll just, I don't know if you've ever been admitted to a hospital before and you have to carry around your, exactly. Alright, so let me just place that one there. Okay. And then our last one. Alright, there we go. go. Just checking again, it's not pulling on any baby hairs or anything. Okay, good. We can't move them too far away from the spot they're currently in. But if they feel okay, we can go ahead and move on. Okay, perfect. Well, that was all of phase 1, so to speak. Now we're going to be moving on to testing the ASMR triggers. So I have a computer screen here that I can see how your brain is reacting to each of the triggers. However, I'm also going to be asking you to rate the triggers on a scale of 1 to 10. Exactly, with 10 being the most relaxing, the most tingly, and 1 being borderline dislike, like it's waking you up, you don't like it, you wish the sound would stop. Okay, let me just get a few things together. And the categories are broken up into visual triggers and auditory triggers. So we're going to start with visual triggers first, so that you can close your eyes and start to fall asleep even if you want to. Exactly with the auditory triggers. So we have just 3 triggers for the visual ones for this first session. And then 1, 2, 3, 4, 5 auditory triggers. And then tomorrow morning when you wake up, we're going to do this again with new triggers. Okay, perfect. I think we're all ready to start the visual triggers. So go ahead and relax, and then we'll begin. Alright, so for this visual section, please keep your eyes open, stay focused on me. Try to take deep breaths if you can. And just look at the movement and the colors in front of you. Try to notice things about them. We're not focusing too much on the sound right now. What color sparkles do you see? Look at the movement of the water. Do you feel anything at all looking at the sparkles, the glitter? Again, this isn't really about the auditory aspect. It's about what you see right now. Okay, so on a scale of 1 to 10, how relaxing did you find that? And did you get ASMR? And it looks like that coincides pretty closely with what the computer is saying, so that's a good sign that you know yourself. You'd be surprised at what some people think they like or want to like, and how it's different from what their brain is actually doing. Alright, now we're going to test some light triggers. we're going to be using red light rather than blue light, because red light is better for the brain before bed. Blue light can wake us up sometimes, so tomorrow morning we will be using blue light. But for now, we're just going to be doing some red light triggers. So just look at me. All right, so just follow these lights with your eyes. Okay, so what would you rate the light trigger? And perfect. Let me just add a note there. Let me just see. Alright, patient seems to be increasingly sleepy. Okay, now I'm just going to be doing some hand movements. Don't pay attention to any sounds you hear around you. Just look at my hands. Okay, so what would you rate that? Of course, every ASMR artist has their own style with hand movements, and some don't do any at all. But you liked this. Good, okay. Let's see, and then pretty similar. Wonderful. So again, we're only doing 3 visual triggers for your before bed exam portion. In the morning, you'll be a little more awake and more willing to keep your eyes open. So now moving on to auditory triggers. You can go ahead now and close your eyes or keep them open if you want. Alright, so let me just get everything together. Okay, so we're going to be starting off the auditory trigger testing with one of the most popular triggers, and that is whispering. I'm going to read the back of this book while whispering, so we'll see how receptive your brain is to that. Are you ready? Alright. The First Sleep Book by a leading scientific expert, director of UC Berkeley Center for Human Sleep Science. Why We Sleep is a groundbreaking exploration very fitting book for this assessment. So, how would you rate Whispers on a scale of 1 to 10? Okay. Perfect. Okay. Now we're going to move on to another extremely popular category of ASMR triggers. Tapping. However, we're going to start with soft tapping and move to sharper, harder tapping. This first style of tapping is known as tacky or sticky tapping. And we're actually not going to rate each individual tapping trigger. We're just going to rate tapping as a whole. Though, of course, all of your data via the electrodes is being recorded for a more detailed report that we'll send you. Alright, so this was tacky tapping. Moving on to the next tapping style. This is cork, and I would describe it as soft tapping. The next level of sharpness, I would say, wood tapping. Still not too loud or sharp or tangy. Let me see your measurements here. Okay. I wanted to tell you before affecting your measurements potentially, but wood tapping is my favorite. as a whole, how would you rate tapping? If you want to get more specific, you can tell me and I'll put it down in my notes. I would like to also add that this is long nail tapping, which can sound very different from short nail tapping and finger pad tapping. Okay. Alright, now we're moving on to scratching. I have 3 pieces of carpet that I'm going to use to demonstrate the scratching trigger. Again, you can have your eyes closed. Just focus on the sounds. Again, moving from harshest to softest. How would we rate scratching from 1 to 10? Okay. Now we have brushing. Okay. Now our penultimate trigger is brushing. More specifically, ear brushing. I'm just going to brush your ears for a minute or 2. So just keep relaxing and listening. would you rate that 1 to 10? Alright. Wonderful. Well, I can see that you are getting very, very sleepy. So I'm gonna head out. Do you need anything? An extra blanket? There is a little button by the side of your bed if you ever want to press it and get a cup of tea, anything at all, really. Okay. Well, good night, and we will see you in the morning.